Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another interesting woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Thank you much, Gertrude. I'm so excited and honored to be here. My name is Claudia Cometa. I am very far geographically from you, which is in Tampa Bay, Florida, on the coast, west coast of Florida. And I am a great, I think, representation of the story. What is the story of the female entrepreneur and visionary? And so I'm excited and honored to share that story with you here today. I'll tell you all about my background. It's, maybe not as geographically as exciting as out in Australia, but I do have some geographical fun in my background. I'm half Italian. So my mom was born and raised in Italy, came over to the States when she was 20. So half of my family is in Italy. I traveled there often when I was young. I'm a dual citizen there. So Italy and Europe are near and dear to my heart. I have a husband who is a physician anesthesiologist and a 16-year-old son who is actually over in Italy now playing soccer and going to school. So lots of kind of traveling fun in my life. But professionally, I grew up as a very dedicated student, which means I was very logical, analytical. Tell me what I need to study for a test. I'll get an A on it. I listened to authority very well, and then found a career that sort of checked all of my desired check boxes. So I wanted to help people. I wanted to be able to have a job that allowed flexibility when I became a mom and was, decently financially lucrative for me to be able to raise a family. And so pharmacy fit all of the things for me. I was really good in chemistry and science. And so I became a pharmacist and graduated in 2003 and worked in the world of clinical pharmacy, meaning I worked alongside medical teams for many years, so about a decade and a half. And then my father was diagnosed with lymphoma. And so, knock on wood, other than this diagnosis, we were otherwise relatively healthy. So no huge diagnoses or experiences in the medical system as a patient. And so I went into advocacy mode for him after his diagnosis and was actually shocked at what I found on the other side of the healthcare equation. So, here I am working away as a pharmacist thinking, I'm doing all the right things and my medical team around me are doing the right things and patients are having this great experience with us. And then I realized that's not what's happening at all. What patients experience is actually a complete 180 from that. And so I was frustrated, discouraged. And I think like any other life event we experience, we decide what to do with that. Do we just, bury our head under the sand? Do I go back to working and just try to do better, knowing that I'm one person and there's many other healthcare professionals who aren't necessarily providing the best patient experience? Or do I try to do what I did for him and try to make a difference for other people and try to elevate the healthcare experience? So I did the latter, and I left pharmacy in 2017 as a traditional pharmacist and started a company called Peace Advocacy Group, so PEAC Advocacy Group, with the intention of helping others walk through the medical system, get the answers they need, have the voice that they need and otherwise feel like they can't have. It's a very vulnerable time when you're sick and you're in a hospital bed and you don't necessarily know the lingo, you don't know your clinical background. And so I'm there for those people. I meet them where they're at. I find out what their goals are, and I'm their voice when they don't have a voice. And then later when they do, and we can kind of get to a point where they feel like they can express their needs and have more productive and effective communication with the team, then, typically my involvement might wane a little bit, but I'm always there for those clients and there when they need me. That's the story.
Thank you so much for coming online and sharing your story with us today, Claudia. It's interesting that your whole career transitioned after this personal tragedy or crisis with your family. So, how did you navigate the initial challenges, and what resources proved to be most helpful for you when you started the advocacy company with no formal business background?
Yeah, that was the biggest challenge. Also, just from a mindset perspective, for those of the listeners who don't know, pharmacists in general are very type A, and we don't really do something that we don't feel we are completely confident and well-versed in. So to start a business when I don't have an MBA, I don't have a degree telling me I can do this. It's not something that we in the healthcare professions, especially pharmacy, would normally do. So first and foremost, I would say mindset work was the biggest challenge for me, is shifting from what I knew of my work to what could be, to have a more visionary, expansive approach of what can happen here if I just am willing to move forward and fail forward imperfectly. And so that was a huge challenge. And then resources wise, I asked a few people that I knew who knew how to do things that I didn't. So my sister was a little bit more tech savvy than me, so she helped me with the website. And I knew a few people in my community who were insurance agents, and so what kind of liability insurance do I need? And I just leaned on a few people here and there on the stuff that I just didn't know. And I didn't have a coach. I didn't even know business coaches were a thing. I really kind of just figured it out in a lot of ways. And that was it. That was a challenge, because just figuring things out isn't what pharmacists do. We go to school, we learn X amount of information, and then we go help people with that information. There isn't really much leeway there. So it was an interesting journey.
Now, you wrote a book that became a bestseller, Empower Thyself. What core message do you hope your readers will get from this book?
Yeah, so this is the book, and the goal of the book is not to be a how to do, meaning it's not a checkbox, here's the questions to ask your doctor. It's more of a how to think, how to approach, how to shift your paradigm around the way that you approach your health and healthcare. So many of us grow up culturally, generationally, with a certain set of beliefs around health and healthcare. So some of that might be my doctor. I have been taught that my doctor is the all-knowing, they know way more than me. So even if something in my gut or intuition is telling me no, their knowledge supersedes that. Also, I'm not allowed to ask questions. If I do, that's disrespectful, or that's questioning authority. And, so we attach meanings to things based on how we've grown up. And so the goal of the book really is to start to shift that a bit, not to now become, the disrespectful adversary, but rather to be a more activated, engaged participant in your health and healthcare. And so that's really kind of the message and the goal.
If we go back to your father's experience, what was it that made you realize that there was a need for advocacy for people who are experiencing these health challenges? What was the main thing that made you go down this route?
So what I witnessed in the beginning was a lot of dismissing of his concerns, also a lot of errors. So I had access to all of his medical records, and I was the one primarily watching everything. So, I would be watching all of the data that's in his charts in real time, some of which would be
Okay.
errors on his weight. So, like his weight was documented as 300 pounds when he was, 170 on a good day. And so while these little things seem insignificant, what ends up happening is, if you end up going through chemotherapy is very weight-based dosing. And so these seemingly insignificant data points can lead to errors. And so, I'm watching all these little errors, seemingly little errors happen. I'm also watching documentation of vital signs and procedures that just simply didn't happen. So, pulmonologist, the fellows in the pulmonology office documenting that they listened to his lungs and they were clear. And 2 days later, he's getting a chest tube. So, then I come to find out that he didn't listen to his lungs at all, but it was just a populated form and it was just like default and copy and paste. And so as I'm kind of watching these things happen in real time, and I'm thinking, I have almost like an extreme level of oversight over this case and understanding what is everybody else doing? What are people doing who don't have this level of understanding, who don't know how to access the medical chart, wouldn't know how to understand it, don't know how to prevent an error because they don't know how it even begins to happen. So and then in the ICU, I'm watching everybody else in their rooms with nobody there with them. And so I'm like,
Wow.
there are so many things that I'm preventing in real time, and these people aren't going to have a chance if they don't have that. So, it was really not, for the first time in my life, I made a decision that was very heart-centered, like it needed to happen. It almost already happened. I just needed to step into it, versus pharmacy, which was very analytical, like checks all the boxes. This really didn't check any logical boxes because I wasn't I didn't have an MBA. I didn't have an entrepreneurial background. My family were not business owners. So logically, this one made no sense, but it did from a heart-centered standpoint.
So in terms of patient empowerment, what are the top strategies that you recommend for patients to feel empowered and make informed decisions in their healthcare?
I would say the first thing is knowing how to access your data. So I think, as business owners, if we think about the parallel, we have the back end financials, the P&Ls, and, we look at numbers and data, and some of us don't really love it. I don't really love it, but the reality is it's there and you need to know it. For your health, it's no different. So you have access, at least in the USA, there's a requirement for your medical offices to provide you with an online patient portal, meaning you can go online and access whatever you need from that physician's office or that hospital system. So you can see your labs, you can see your image results, you can see what the doctor's notes say. So the transparency is there, but if you I can't even tell you how many patients I help who either don't know what that is, have never they're like, yeah, I got an email, but I don't know, I don't know how to log into that. And I can promise you that ignorance is not bliss. So not knowing does not help you. If you see something in there that is like not true. I've had clients who, we'll look at their imaging results and it'll say, yeah, they can see a history that there was a hysterectomy. And she's like, I've never had a hysterectomy. So errors can happen. And if they continue to be documented in your chart, then future physicians are going to be making decisions on erroneous information. And so you can catch something like that and actually have it fixed. So you can actually bring it up to that hospital system and say, hey, the radiologist who read this and said I have a hysterectomy, that's not true. I need that to be fixed. And we did, and it was fixed, but you will never know if you don't look. So first and foremost is to know, have access to your data and know what your data is. You may not understand all of it, and that's okay. You can understand what you can understand and then lean on somebody who can help you, whether it's a hired advocate or a friend who's in the medical field, but definitely get access to that. And then secondarily, I would say it's to kind of release some of these limiting beliefs. So, like I just mentioned, if you did grow up in a environment where the way that we approach healthcare is to just sit passively and let the all-knowing doctor do their thing, and I'll just leave and take my prescription and do whatever he or she says, start to question that, question where that belief came from. And if it's a belief you want to keep going, or if you want to start to unlearn that and relearn a new paradigm that helps you some more, where you can get you can be more activated and engaged patient.
I like that. So how do you see your work influencing health policy or patient care practices at a larger scale?
Well, that's a great question because that's sort of the second phase of my company's goals. So we've for the last 8 years been very much dedicated to one-on-one, very concierge level, private level care. And so now we're starting to talk to larger organizations, so small and medium-sized medical clinics, getting much more involved on LinkedIn, talking to hospital CEOs. Actually, recently I just brought up a hospital CEO my book, and he's going to use it to talk to his leadership team so that they can understand what patients are experiencing. Yeah. So it's, so that is actually sort of the second phase is how do I take what I know and rather than, and, I love the work that I've been doing and will continue to do it. But the reality is working one-on-one is limited and I'm only limited to the impact I can make with that. Unless I can turn that into a larger scale, elevating healthcare type of a plan. So that's sort of the vision and that's playing out now. And we're working on that now.
So, with your deep experience in the field, where do you see the future of patient advocacy heading over the next decade?
Well, I love so Brad Schwartz is one of the leaders in advocacy. He's actually an attorney who experienced a quite life-altering experience in the healthcare system where he lost all his limbs because of a sepsis that was not treated appropriately. And so he has sort of paved a path and he has a nonprofit organization. But the reason I bring him up is his vision has become a lot of our visions as advocates, which is at some point we envision everybody having an ad. So when you go into the hospital and you check in and they say, what's your name? What's your phone number? What's your insurance company? And who is your advocate? The assumption is you have an advocate. And whether that's a paid advocate or, it's a pro bono or there's a nonprofit helping you, but somebody is there to be your advocate. So that's sort of the long-term vision. Obviously, we're very far from getting there, but that's definitely a vision that we're all holding.
Okay. So what advice would you give to someone who's looking to enter the field of patient advocacy?
I think it's a fantastic field. It's a growing field. It has a lot of opportunities for people of varying backgrounds. So I've actually taught courses to people, walked them through the process of becoming an advocate and people from all kinds of backgrounds. So you don't necessarily have to have a specific healthcare professional degree. There are people who have been patients who want to advocate for other patients. And so the goal here is to be really clear about your skill set and knowledge base and share that with the people who need advocacy. And then the people can decide, which background fits their needs the best and who they interact with and the energy, which energetic alignment is best for them. And so, what I would say is connect with somebody who's already doing this work. And that is relatively easy to do now. It wasn't as much when I started. It was much, much younger in its infancy then. But now there's lots of online directories. There's gnanow.org, which was Brad Schwartz nonprofit. You can reach out to me. I'm happy. I talk to people all the time who are interested in this field and just kind of want to know, what does it look like? How do I get started? If I wanted to do this, is that even possible? So yeah, reach out to somebody who's doing it. Most of us are very open to having those conversations because we want more amazing souls doing this work.
So how do you guide your clients through the complexities of the healthcare system to ensure that they receive the best possible care?
Yeah, that's a great question. It looks like a lot of different things, but I'll give you a few examples. One right now I have is a patient in a hospital, an elderly female in the hospital who doesn't have any family members here. Her family members are a couple hours south of me. And so they want somebody to watch out for her. She's in the hospital. We don't know what's going on. We don't have a medical background. So even, we can't be on the phone all day trying to call a nurse and figure out what's going, can you please step in, make sure she gets the care she needs. And so that's what I've been doing here is I go to the hospital to visit her every day. I monitor her chart for her. So I'm looking at the labs. I'm making sure that if there's any red flags, we're addressing them. And so that's happening here. I've also had cases where it's an elderly father of an adult daughter, and he's in the ICU. She is there physically with him, but has no idea what's going on. Again, no medical background, actually isn't even from this country. So there's some language barriers. And, she wants somebody to keep an eye on her dad. This was during COVID. And so I actually became part of the rounding ICU team. So they would literally take their laptop and just turn it around, and I would talk to every member of the team and let them know if there were any concerns I had, or ask them if they could add in, just some vitamin supplementation like vitamin D and zinc, as can we support his immune system while you're doing the other things? Are there things that we can do to optimize his health so we can get out of the ICU? And so, so those are a few stories, but really people call me in with all kinds of needs and all kinds of stories. And I just meet them where they're at, and we kind of lock arms and walk hand in hand together.
Now, you're working in a very difficult field. On tough days, what keeps you motivated and focused on your mission of patient advocacy?
I mean, it all stems back to the experience with my dad. And I think about every client I have, I think about how amazing it would be if even I had somebody to advocate for him, and I could have just been the daughter, not just, but I could have focused on being the daughter, and not having to be in the minutia of the weeds of the medical stuff and micromanaging all of that. It would have been really peaceful and wonderful if I could have relied on somebody else for all of that, even though I have the ability to. So, for people who don't have the ability to, is even more important. So that's what keeps me going. And of course, the feedback that I get ongoing from my clients. I mean, it's just like, you're a gem, you're a lifesaver, recently a client of mine was in a restaurant, and a pharmacy colleague of mine, so somebody who went to pharmacy school with me, walked in. He had my book on the table, so she recognized my face, and he said, she stopped him and said, "Hey, I know that girl. Like, I went to school with her." And he goes, "Oh, she saved my life." So it's those types of stories that, like, there's no way I could stop doing this. There's not even a question. So yeah.
So as an entrepreneur, what have you learned about entrepreneurship in healthcare that you didn't know when you started?
I had literally everything. I mean, literally, there wasn't a single thing I knew. And I didn't even know what I didn't know, I think, is really the key, which some of that ignorance might have been a little bit bliss then, because maybe if I had known everything, I would have talked myself out of it. But, what I have learned is the importance of having an expansive and sort of visionary mind for your work. Because I think when you're in a traditional setting, like in a pharmacy or in a clinic, you see yourself in a very like finite box. There's only so far I can go. There's only so many tasks I can do. But as I've had coaches and I've been around people who just think way more expansively than I historically have thought, I see how, like, literally they think the sky is the limit. I mean, the way that they think and the way that they talk, and it's just a totally different mindset. And so I think getting around people who think differently and think largely and expansively is so important, because it will blow your mind. I mean, it blew my mind. And so I make sure I surround myself with entrepreneurs who are doing amazing things, who you bring something up to them like, yeah, I was imagining this, then they just say, just do it. Like, just go do it. There's no reason not to just do it. And so that was a mindset I did not previously have. So that was probably one of the biggest things. All of the logistics I think can be figured out. You can figure out expenses and taxes, and you can figure out, invoices, and none of that I think is, earth-shattering. But I would say the mindset shifts have been the largest shifts for me. Yeah.
So in terms of the future, what are some of the projects or initiatives that you hope to tackle in the near future to further enhance patient advocacy?
Yeah, so I recently became certified in what's called unreasonable hospitality. And what that is a framework that has historically been used in the fine dining industry. So my goal is actually to bring in best practices from other industries, because I think in healthcare, we siphon ourselves off and silo, and we're like, but we're different, so none of that applies to us. And I disagree completely. I think the hospitality piece and the connecting with people as humans and the ability to go above and beyond, that potential exists, and we aren't optimizing it. And so I became certified in that program. And the goal is to begin to bring that to healthcare organizations. So to sit with healthcare leaders and say, let's go through this journey, this customer or patient journey, and find points that we can elevate what we're currently doing. And so that's really kind of my goal now. Of course, obviously, to spread the news on the book and to make sure people realize they have agency and a voice in their healthcare journey. And so those are my focuses right now.
Now, my last two questions are a bit of a thought experiment. In the first one, I'm going to teleport you back to the past. And we're going to go and sit with that young woman whose father was unwell, thrown into the healthcare system, unsure of where to start, where to begin with this whole challenge. Just in case there is someone who's listening to this podcast right now and is where you were at the beginning of your journey, if you could go back and give her 3 nuggets of wisdom based on what life has taught you up until this point, what would those 3 nuggets of wisdom be?
Wow. Yeah, that's a really great question. I would say first and foremost is I'm a woman of faith, and so for me, first and foremost, it would be to continue to lean on your faith. So there will be times that will challenge you, there will be times that will challenge your faith, and to always keep that steady and strong first and foremost. And second would be to prioritize your own well-being as you continue on this path. So I think what I have learned that I didn't necessarily do so much in the beginning is prioritize my own self-care. So when I'm filling out my calendar for the week, what am I doing for myself, both mindset wise, but also for my body? Am I nourishing my body? Am I moving? And making sure that's not secondary and only if the time allows. And then thirdly is to do what your heart tells you to do. So don't take any more opinions. Don't ask people if you should do it. Don't look for advice, but to have a deep connection to intuition and source, and trust that even when it doesn't make sense, and trust it even when it's asking you to spend money you think you don't have, or do something your husband doesn't understand. But to trust it and move forward anyways.
I absolutely love those points. Yeah, you're very right, because a lot of times the caregiver sacrifices their own mental health, their own health in supporting of a family member. And it's that whole analogy of being on an airplane and putting the oxygen tank on you first. I think people forget when you're in the middle of a health crisis that unless you're taking care of you, you can't take care of anybody else. Beautiful
Absolutely.
reminder. And now if I teleport you into the future, and we are going to go and sit with a 90-year-old you. Maybe she's sitting in a rocking chair. Maybe she's dancing on a dance floor with science and technology. I'm pretty sure you're one of those people who's not going to be sitting down. But if we could go into the future and have a conversation with this wise woman who has led you up until this point, what will you say to her when you finally meet her? And I love asking women this question because a lot of women don't realize that the wise woman is already in them. There was something in you that told you to get up and stand and advocate for your dad. There was something in you that made you start this organization. And now you've impacted on hundreds of people's lives. What will you say to the wise woman when you finally meet her?
Yeah, I think it'll be deep gratitude, just deep gratitude for staying the course and for trusting in the guidance of heart, intuition, higher source. Just deep gratitude. I've done a lot of future self meditations, and it's very, very powerful to see yourself, to realize that that person is in there. I've even done meditations where that future self is talking to me now, and recently did one, and what I immediately heard her say was, you've already done it. You've already made an impact and revolutionized healthcare. You just need to allow it to happen in the timeline that it needs to happen and stop pushing. And so I think a lot of us could really benefit from the wisdom that we have inside of us. And so I love this question, and I think it's great that you're asking it. And so, yeah, for me, looking forward to the 90-year-old, it's just a depth of gratitude for doing the work and staying committed to it.
I absolutely love it. Yeah, so I have a game that I play where if I'm working on a project, I play with the energy of who I am becoming, like you. So I go into my meditation and my prayers at night, and if I'm really stuck, I go to sleep with a very simple question in my head, and it's, what is the next step? I have no idea what to do next. And I wake up in the morning, I'm in the shower, and I get those light bulb moments where it just drops and I know exactly what my next step should be. Or I talk to people about what I'm working on. And throughout the week, it's like a jigsaw puzzle. One person will say this, another person will say that. By the end of the week, this thing has just come together. And you look back a week later, you didn't have an answer then, and the answer is right in front of you. So thank you for listening to your intuition and trusting it. I think that's a muscle that many women need to learn how to develop, because the more you use it, the stronger it gets, and the stronger it gets, the more you use it. Thank you for gracing us with your story today.
Thank you so much for having me. It was an honor. And I love your energy and I love your flow of your podcast. So thank you for having me on.
Absolute pleasure. So how can people get your book and how can people solicit your help?
Yeah. So Peace Advocacy Group, which I know you've had on the screen, is really sort of the hub for all the things. My book is on there as well. All of the things that I'm doing, all of the services that I provide are on there. There's even a chat function. You can chat there with me. You can also email me, Claudia@peaceadvocacygroup.com, if you'd prefer to just immediately jump into a conversation, and that's perfectly fine too. But yeah, all the things live on the website.
Fantastic. Thank you so much, Claudia. And thank you to everybody who tuned in. The Her Story Circle is not just a podcast. We are a social impact movement that brings you the stories and voices of women from all over the world. We share our stories to uplift you, inspire you, energize you, but most importantly, to empower you with knowledge, with tools to take you from where you are now to where you're trying to go. So if you know somebody who is in the middle of a health crisis right now, is needing advice, doesn't even know where to go, here is a resource for you. Please make use of it and share this podcast. I'll be back again tomorrow, everybody, with yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And Claudia, thanks again for the interview.
Thank you so much.
Bye for now, everybody. Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making